Let's talk about the coronary circulation. And the coronaries are the arteries and veins that are on the surface of the heart. They actually supply the heart muscle, the heart chambers with blood. The arteries themselves are going to come right off of the base of the aorta. So we just described this right above the semilunar valve, the aortic valve. The right coronary artery, which we can see coming along the right auricle, is going to supply most of the right chambers of the heart, right auricle included, and then it's going to come around the back. So here's an anterior view of the heart. Here's a posterior view. So the right coronary artery comes around the back, around the base of the right atrium, and then here it gives off the posterior descending artery, which supplies the posterior part of the septum. So those are going to be some of the branches we see from the right. As far as the left coronary artery, it's going to go in the opposite side of the heart. So here's the origin of left coronary. It's going to descend in between the pulmonary trunk and the left atrium. And then it's basically supplying the left sides of the heart, left chambers, and it's dividing immediately into left anterior descending. This is also called the anterior interventricular because it supplies the anterior part of the interventricular septum. And then the second branch from that division is the left circumflex. And as the name implies here, this left circumflex is going to arch around the left atrium and go towards the left ventricle, supplying the left and posterior parts of the heart. Okay, so here's your left coronary artery, anterior interventricular, also called left anterior descending, and sorry, my cursor's freezing. And then the left circumflex, which goes towards the left and back of the heart. And then in terms of the veins, there are several veins that are on the heart. We have the um, lesser veins, greater veins, etc. Great cardiac vein, lesser cardiac vein, least cardiac vein. The only vein that we're going to be looking at is the final vein that drains back into the right atrium. So this is the coronary sinus, which is this venous structure. This wraps around the base of the left atrium. So we can better appreciate this at a posterior view. Now notice it's going to be collecting venous drainage from those smaller branches that I mentioned. The lesser cardiac vein, the middle cardiac vein, which is along the posterior border, the great cardiac vein, which is along the anterior, and then all of that drains back into coronary sinus and back into the right atrium, okay, where most of that poorly oxygenated blood ultimately ends up. Let's look at some of the other venous structures, starting with the superior vena cava, and look at some of the areas that this drains, some of the veins that drain into the superior vena cava. So superior vena cava receives right and left subclavian veins. These are the veins that drain the upper extremities, right? These are going to be draining blood from your limbs, upper limbs. It's also going to receive drainage from your jugular, your right and left internal jugular veins. All right. And that is draining blood from your head and neck on the right and left, respectively. Now, together, those join to form the brachiocephalic veins. So the internal jugular and the subclavian merges to make the brachiocephalic. So here's the right brachiocephalic, the left brachiocephalic on the left side. Now, left brachiocephalic is much longer because it has to cross the midline, right? Cross to end up on the right side of the thorax, and then it can merge with the right brachiocephalic vein, and then together they form the superior vena cava. So that is all of your venous drainage from the head, neck, brain, and upper extremities on both sides of the body, basically everything above the diaphragm. Let's look at the aorta, right? The other main vein that is found at the base of the heart. So the aorta and some of its branches, immediately from the aortic valve, we already discussed the origin of the coronaries. So that is one of the first branch. So in terms of the um, if you were to be given a question on what is the first branch of the aorta, it's actually the coronary branches, but we've already discussed those. Now, the other major branches that come from the arch, those are going to be the brachiocephalic on the right, brachiocephalic trunk. Then we have the left common carotid in the middle, and then the left subclavian artery being the third branch from the arch. So these are coming immediately off of the arch of the aorta and are giving rise to the branches that supply the head and neck. Now, if we look at how those branches eventually distribute, the brachiocephalic trunk, excuse me, so there's only one brachiocephalic artery, and that is the trunk, and it's only found on the right. That will immediately divide into the subclavian artery on the right and the common carotid artery on the right. Common carotid eventually divides, as we spoke about last week, into external and internal, external supplying the face, and internal supplying the skull and brain. And then subclavian artery basically supplies the upper extremities. On the left now, there is no brachiocephalic artery. We have the common carotid coming immediately off of the arch. That is going to supply those regions we looked at, the head and face and scalp. And then the subclavian on the left is coming also immediately off the arch, supplying the upper extremities. Now, the arch is going to continue to curve posteriorly and descend in the thorax to form the thoracic aorta. The thoracic aorta is going to pierce the diaphragm at T12, and then it's going to become the abdominal aorta and give off branches to the gastrointestinal organs. So when we look at the thoracic aorta, it is going to eventually give off the intercostal arteries. And we looked at the intercostals last week. These are the branches that are found running in between the rib spaces. So those are immediate branches coming off of the thoracic aorta. Let's look at the pulmonary vessels. So we discussed the origin of these from the heart, and you can look at how they branch. So the pulmonary trunk gives rise to pulmonary artery on the right and left. Those are going to divide and immediately begin to supply the lungs right at the hilum of the lung. Lower, we have the pulmonary veins. These are coming back to the left atrium, and we're going to find two on each side. So the superior pulmonary veins paired right and left, and the inferior pulmonary veins paired right and left as well, coming back to the left atrium. Here's how the pulmonary vessels look in situ, so kind of the way they are without the heart removed. So we can see the pulmonary trunk, pulmonary arteries. These are entering the lung at the hilum, and then pulmonary veins in the lighter pink coming back. Notice how they're all going to the left atrium, right? All four of these going towards the back of the heart, the base of the heart, towards the left atrium. Similarly, we have the inferior vena cava. So we talked about the origin of the superior vena cava and some of its tributaries or the veins that dump into the superior vena cava. We also have the inferior vena cava, and this receives poorly oxygenated blood from everything below the diaphragm. So all of your abdominal organs, all of your gastrointestinal organs that go through the portal circulation eventually go to the liver, and then the hepatic veins from the liver are going to come back to the inferior vena cava. But then all of your lower extremity drainage as well that's coming back from your legs, right? Your lower extremities. So that is all drained into the heart by way of the IVC. Now, we looked at some of these nerves last week, but because they're also structures in the thoracic cavity, closely associated with the pericardial sac and diaphragm, we're going to look at them again as they relate to the heart. So the vagus nerve, particularly its branches, so the recurrent laryngeal. So here's our vagus nerve again. Remember, this is going to be more medial in terms of its location compared to phrenic. This is one of our cranial nerves, cranial nerve number 10, and that is giving off the left recurrent laryngeal nerve, which wraps around the arch of aorta and is going to go back up to supply the laryngeal muscles. On the right side, because there is no arch of aorta, the left recurrent laryngeal actually, excuse me, the right recurrent laryngeal actually wraps around the subclavian artery. So here's the vagus on the right. Here's the right recurrent laryngeal, and that recurs or wraps around the right subclavian artery. Now we can compare that to the phrenic, and phrenic being more lateral to the vagus. Here's the phrenic nerve descending on the outer aspect of the pericardial sac, and that will supply the pericardium and the diaphragm. That is going to go all the way down to the diaphragm and then eventually supply, whereas the vagus is going to go through the diaphragm. It's going to pierce along with the opening for the with the opening that goes through the diaphragm. So we want to think about the location of the vagus as the posterior mediastinum, the location of the phrenic as the middle mediastinum.